between the body and the ramus. At the top we have a coronoid process anteriorly and a condylar process more posteriorly. If we notice right here, here's a mental foramen. The skull looks like it has some periodontal disease. It also has, interestingly enough, some plastic teeth, I think. Let's see. Yeah, tricky. I thought we wouldn't notice. Maxilla. Here. Zygoma. Here. Here's the frontal process of the zygoma. Here's the maxillary process of the zygoma. Here's the temporal process of the zygoma. And then coming back here, this is the zygomatic process of the temporal bone, and the temporal bone here with this large flat squamosal portion, its mastoid portion here. I don't think there's much of a styloid on this skull at all, but it's basically, there's a little bit where it was broken off here, and over here on this side, a little bit where it was broken off here. The reason why that's somewhat significant to be able to see that a little bit more clearly is there's a foramen that lies between the styloid process and the mastoid process, and that foramen is right there. I don't know if the pin shows. That foramen is right there. That's the stylomastoid foramen. And that's actually the opening for the what's called the facial nerve proper as it comes out to the face. On the top of the skull, front of the skull, the nasal bones here. As we go into the orbital chamber, on the medial wall, there's a nasolacrimal canal and the lacrimal bone right there. Here in the front is a infraorbital foramen. I don't know if we can get a thin wire through here. You see here the infraorbital foramen goes into this infraorbital groove and into the inferior orbital fissure inside the skull. So that's something that you should look for. Superior orbital fissure. We see back here. And a little farther medially is the optic canal. So, trying to rotate this. I'm not doing a good job. Right back there. Okay, that's the optic canal. On top of the orbital rim, and this is a male, by the way. You see it's got a little bit more of a glabellar prominence here in the midline. If you look at the skull, you can see bulbous brow ridges here in relationship to this male. Usually they have pretty good sized mastoid processes, but they have shorter styloid processes. Females usually have longer styloids. Here on the top of the orbital rim is a superior orbital foramen. There's actually a pair of them. That's not an unusual formation. You can usually see more than one. Both of these are completely closed, so there is no supraorbital notch. You would call it a supraorbital foramen. Over here, we come to the temporal bone. Once again, with its mastoid process, its squamosal portion, its zygomatic process here. This is called the zygomatic arch between the zygoma and the temporal bone. There's a muscle that actually runs down behind this arch. We'll talk about that when we get onto the face. Okay. Here is the external acoustic meatus. Okay. If we come around to the back of the skull, you got to pull back. The back of the skull here. Here is the occipital bone. There is a suture that is coming up here to meet the median suture and coming down to the other side. That's a lambdoidal suture. Where it meets the median suture, they call it the lambdoidal suture because it looks like the letter lambda. If we continue and we on to the base of the skull, in the occipital bone is this large foramen. The foramen magnum lies in the occipital bone. In the front of the foramen magnum are two articulations. Those are called occipital condyles. I'm going to take the mandible off here. Okay. So now in the base of the skull, there are some openings. I don't know if how well we can see them. Let's try using the as we come from from backward to forward, underneath the occipital condyle, this is okay. Underneath the occipital condyles, there is a foramen that transmits the 12th cranial nerve. That's called the hypoglossal canal. And that runs directly underneath the occipital condyles. Sometimes this skull, I think, has one back here. There is a foramen that also comes in behind the condyles. This purple pipe cleaner demonstrates that. That's called a posterior condylar canal. And there are some of these extra canals, they transmit what are called emissary veins. An emissary, takes information to a group of people. Emissary veins take blood from one surface to another. So they take blood here from the inferior surface of the skull internally inside the skull. As we move forward here, probably the next largest foramen is this one right here in front of the hypoglossal foramen. On the opposite side here, we're showing that. That's the jugular foramen. Okay. Jugular foramen is important for two reasons. One, that's where the internal jugular vein starts, but also there are three cranial nerves that pass through that foramen. Cranial nerve 9, cranial nerve 10, and cranial nerve 11 have structure that passes through that jugular foramen. If we go a little bit farther forward, there is another opening. We'll see how this moves through here. But this foramen has an interesting name. It's called the external carotid foramen. Now that's a little bit of a confusing term because what goes through this opening is not the external carotid branch of the common carotid artery, but it is the external opening for the internal carotid artery as it enters into the skull. And I'm going to take the calaveria, the skull cap, off for a second here. If you'll notice, it comes into the cranial vault, into the anterior portion of the cranial vault. It travels through a canal. That canal is called the carotid canal. And that's how it travels into the cranial vault. That internal carotid, remember, gives off no branches until it comes inside the skull, and then it'll give off what's called an ophthalmic artery, maybe some tympanic arteries, and it'll also give off one of the four main blood supplies to the brain. If we go a little bit forward here, there's another foramen, and this gets a lot of play in anatomy books, but a lot of people have a lot of different opinions about it, including myself. This is not really a complete foramen during life. There's a lot of connective tissue that covers it. This is called the foramen lacerum. Some people feel it's not a foramen and that nothing goes through it. I can assure you that that's not true. There are two structures that possibly can go through it. One of it is a branch of the external carotid called the ascending pharyngeal, and another is a branch that comes from the inside and comes through it, and that is called the nerve of the pterygoid canal. There are actually two autonomic branches we'll talk about. One's postganglionic sympathetic and one's preganglionic parasympathetic that come together to form a nerve of the pterygoid canal, and in order to get to the pterygoid canal they have to drop down through this foramen. So this is the foramen lacerum. Now I'll leave that in place and we'll go outside of this opening. There is an opening here. Okay, there's a small opening here where this pin is going through. That's called the foramen spinosum. It's given the name foramen spinosum because right alongside of this opening is a projection, a spine. That's called the spine of the sphenoid bone, and that's where the foramen gets its name. But more importantly, there is a sub-branch of the maxillary artery, which is a branch of the external carotid, which is given off through that opening, and it's called the middle meningeal artery. So it's a rather significant artery that passes through that opening into the skull. So that's the foramen spinosum. In front of that is an oval-shaped foramen, and that's the foramen ovale. That transmits the third division of the trigeminal nerve known as the mandibular division. Okay. These processes here, and here, those are the pterygoid plates. Those are the processes of the sphenoid bone. Those are an intermembranous ossified portion of the sphenoid bone. There's one that's more lateral. There's one that's more medial. The one that's more medial has a hook on the end of it right here. And that hook is called the hamulus. Hamulus means hook. That's called the pterygoid hamulus. And there's a pharyngeal muscle we'll talk about when we talk about the pharynx that goes in there. As we come up onto the palate, there are two bones, remember, that make up the palate. This bone back here is the palatine bone, and there is a small spike in the back of the palatine bone. That's the posterior nasal spine. In the palatine bone are two openings. There is a smaller, usually posterior opening, and there is a larger anterior opening. And these are called lesser and greater palatine foramen. Okay, lesser and greater palatine foramen. The lesser is more posterior in position, the greater is more anterior in position. And then there is a opening in the front of behind your central incisor teeth. That's called the incisive canal or the nasopalatine canal. And the nerve branch that comes down through there actually runs on each side of the nasal septum to come down and enter through the floor of the nasal chamber and into the back of these teeth. If you ever had a nasal septal procedure, usually it involves mostly the cartilage, but sometimes they go too far back and they fracture the bone, and then you wind up with permanent numbness behind your central incisor teeth. So, any of you who've ever had a nasal septal procedure, if you notice that, that's the reason why. Okay, let me turn this alongside here, and let's see if we can look into, I'm not showing it very well. Okay, there it is. Here is the zygomatic arch out here, and as we go deep to the zygomatic arch, then we come between the back of the maxilla, the upper jaw, and the pterygoid plates of the sphenoid bone. Okay. If you'll notice here, there is an opening between the two bones. That is called a pterygomaxillary fissure. Pterygomaxillary fissure, and that's a rather significant opening as well in terms of what nerves it transmits into this region. Let's look at the mandible first, then we'll look at the skull of the cranial vault. Okay, on the mandible. He's afraid I'm going to throw it across. That's Dr. Belovich's skull. She protects it with her life. If you want a bony skull, by the way, these things these days cost around $1,000, so unless you find one out in the field yourself. Here are the mental protuberances. As we come back here, here's the mental foramen. This is the lower border of the mandible here. Comes around this large process here is called the angle. The scientific name for that is the gonion. Okay? So sometimes there is a groove in the bottom of the gonion, and how that occurs is that the submandibular gland, when it develops in that space, and it actually creates this groove on the bottom of the mandible, and they call it the antigonial notch. It's also an area where the facial artery and the vein, they cross onto the face through this notch, or over this notch. The body meets the ramus, the arm of the mandible. In the front is a coronoid process. That's a muscular attachment for a muscle called the temporalis. Back here is the neck of the condyle and the head of the condyle. The top of the condyle is the head. There's the neck of the condyle, just like in a long bone. Remember I told you it has a very similar type of ossification process. And there are some other muscles that attach to the neck of the condyle. One's called the lateral pterygoid. We turn the mandible around. There are, in the very front, there are little bumps. If you look at the skulls upstairs, these little bumps are called genial tubercles, and there's an upper bump and there's a lower bump. The upper bump is where the genioglossus attaches the tongue to the mandible. The lower bump is where the geniohyoid attaches the mandible to the hyoid bone. Then there's a ridge that comes down on each side to meet the genial tubercles. That's called the mylohyoid line or the mylohyoid ridge, and that will come forward from the side. The mylohyoid muscle makes up the floor of the mouth. Also in the front here, there's a little depression on each side of the midline, and that depression is caused by the anterior belly of the digastric attachment there. So that's where the anterior belly of the digastric attaches here. And then in here, there's an opening. This is called the inferior alveolar foramen. Some people call it the mandibular foramen. This is where the mandibular branch of the trigeminal nerve, the fifth cranial nerve, gives off a branch called the inferior alveolar. That is the nerve that supplies the lower dentition and some of the lower soft tissue. The term alveolus is basically implies the structural support for the teeth. The alveoli are the tooth sockets, the bony tooth sockets. So there are superior alveoli in the maxilla and inferior alveoli in the mandible. If we look at the skull cap here, we're looking inside the skull cap or the calaveria. I don't know if you can see it, but there are grooves. There are grooves in here that look like branches from a tree. Those grooves are formed by the branches of the middle meningeal artery. That artery we talked about that came into the skull through foramen spinosum. There are also in here, alongside the median suture, there are little depressions in the skull. These have an interesting name. They're called Pacchionian depressions. And there's a structure that is a valve that allows cerebrospinal fluid to return from the brain into venous circulation, called arachnoid granulations, that create those indentations in the skull. If we look at this outer rim of the occipital bone back here, there is a dense outer table and a dense inner table, and lying between them is a layer of cancellous bone. These cancellous bone layers you find throughout the body. This is really where your marrow spaces are. This is where your blood cells are produced. But in the skull, this space is called the diplo, D-I-P-L-O, umlauts over the O-E. Okay, let's look inside the skull. We see here once again the foramen magnum, and we can also see here coming out, the condyles are down here, the occipital condyles are down here. Here is the internal opening on each side, in this case above the condyles that form the hypoglossal canal. If we go out to the side, and remember this is the posterior cranial fossa back here, out to the side, this is the jugular foramen, here and here. Okay, so the jugular foramen is prominent, okay? We don't really see, remember from the outside what we saw just in front of this was an opening called the external carotid foramen. We don't see that here because the carotid enters into a bony canal inside really the temporal bone, inside the petrous portion of the temporal bone. So this is the petrous portion of the temporal bone here. The foramen that we do see here is called the internal acoustic meatus. This is the internal acoustic meatus. And that, what goes through there is the facial nerve, cranial nerve 7, and the vestibular cochlear nerve, cranial nerve 8. As we come more forward here, this is the middle of the sphenoid bone, and this structure right here, that's the sella turcica. And just in front of the sella turcica is an optic canal on each side. Underneath this wing here, this is a lesser wing of the sphenoid bone. So this is the optic canal. If we go down alongside this, we are in now the middle cranial fossa, and back here you can see, let's see, maybe we can see it better on this side. Back here, where'd we go? That's the foramen spinosum. That's the foramen spinosum right there. And just in front of foramen spinosum is the foramen ovale. You see the oval shape of that foramen. And then if we come a little bit more forward here, I don't know if we can see that. This is a perceptual challenge. Okay. We can sort of see it right there. That's the foramen rotundum. Foramen ovale was back here, was back here, and this is the foramen rotundum under here, and then just above it, over here, this is the superior orbital fissure running under the lesser wing of the sphenoid bone, or between the lesser wing and this here, this is the greater wing of the sphenoid bone. If we come forward in the skull, we see that in front of the optic canals, in front of the lesser wing, is this region here, this perforated plate with this spike in the middle. That's the cribriform plate, and the spike is called the crista galli. If you come over and take a look at this skull, one of the things that's interesting about it, we talk about mammals being bilaterally symmetrical, but you can definitely see that in this skull that there's some bulging out over here to the left side. And so it's not totally symmetrical. And that's something you ought to think about with your patients all the time. We think in the realm of bilateral symmetry, but that doesn't always hold. And that may have an effect on how they walk or how they chew or whatever. Okay? So when you get a chance to go up to the bone room, we'll take a look at the skull again when we get intracranially. Today in the laboratory, probably the best thing that you can do is dissect from the top down. Dissect the scalp. Okay? If you haven't finished dissecting the entire neck, and I say that because if there's structures in the neck you haven't seen, okay, if you think that that makes you safe for the examination, you're totally wrong. There's a lot of stuff in the neck, especially in this upward junction between the lower jaw and the neck. So be sure you see everything in there. We'll come around and look at that. But if you've done that, what you can do is start in the midline of the scalp, make a thin incision, and start to take the scalp, the skin of the scalp back to the sides, because we're going to open up into the calaveria, at least in some of these skulls, I think, and take the brains out. So do that. Make a thin incision. Just try and get under there and push the skin back. In the front of the skull, you'll see some actually facial muscles, a facial muscle called the frontalis. So if you're at that point, you can start that today. During the week, try and get into the bone room to look at the skull. There will be components on the skull on your examination. Okay, and we'll be around to help you.